Hello everyone, welcome back on Meds. I'm your host, Mr. Meds, aka King Meds, Nkosi Amakambi, Kanenibona Nibote Zaneyeza. So I've already introduced the segment on my previous video. This is going to be the second video of our segment. Our segment's name is Meds Talk. So in this segment, we are discussing medication, how to use medication, side effects, and common brands that you find in the country and their schedule. All of that, you'll find it in this segment. So we are still talking about pain management. I think we're going to talk about pain management for a long time because there are a lot of medication that is used for pain management. But today I want to start with NSAIDs. What are NSAIDs? NSAIDs are non-steroidal anti-inflammatory drugs. They are called NSAIDs. I'm sure you've heard this word being thrown around a lot of time. People saying NSAIDs, NSAIDs, and you wonder what is an NSAID. They're basically non-steroidal anti-inflammatory drugs. So why are they called non-steroidal anti-inflammatory drugs? Are there other kind of anti-inflammatories? Yes, there are other kind of anti-inflammatories. The steroids, as I said, this is not steroid. That means there are steroids that are anti-inflammatories. Basically, your cortisone is also a steroid. The steroidal anti-inflammatory. Cortisone helps with inflammation, although not much for pain, but it helps with inflammation. Example of cortisone you most commonly find in the country and most commonly used one is prednisone. There are other kinds of steroids in the country, but the most commonly used one is prednisone or prednisolone, which is a kids version, your aspirine. So when it comes to non-steroidal anti-inflammatories, you get quite a lot of them. Most of them were used to them. We just don't know those are non-steroidal anti-inflammatories. The non-steroidal anti-inflammatories include your aspirin, your ibuprofen, your diclofenac, naproxen. There's quite a lot of them. But today I just want us to focus on our first anti-inflammatory, which is aspirin or acetylsalicylic acid. Whichever word you want to use, it can be aspirin or acetylsalicylic acid. Aspirin is one of the most accessible non-steroidal anti-inflammatory in South Africa. That is because it's one of the less restricted anti-inflammatories in the country. Most of the anti-inflammatories you will have to get them at the pharmacy over the counter, but aspirin you can actually get it in the front shop. There's no restriction on aspirin. There are a lot of aspirin containing products in the country, which makes it probably the second best-selling pain medication after paracetamol. Yeah, it's probably that. I wouldn't really consider aspirin as one of the safest painkillers, but it is less restricted compared to other anti-inflammatories. Now that I didn't mention paracetamol in the list of anti-inflammatory, that's because paracetamol is not really an anti-inflammatory. It's a painkiller, yes, but not an anti-inflammatory. That's why I didn't put it on the list of anti-inflammatory when I counted anti-inflammatory. What is it used for? In South Africa, aspirin is indicated for fever, pain, inflammation in adults only. In adults only, that's very important. It is also used as a blood thinner to prevent clots that may lead to stroke. Obviously, stroke is caused by mostly clots. It is also found in most over-the-counter common colds and flu combination due to its fever-relieving properties. It is also found in most front shop combination with paracetamol for treatment of headache, toothache, pain, and fever. I'll show you maybe on my next video one of the products that is written outside like this one that contains paracetamol and aspirin. On my previous video with paracetamol, I started with discussing who can use, but on this one I don't think I'll be able to do that because of the amount of side effects or the amount of contraindication that aspirin has. So who shall not use aspirin or acetylsalicylic acid? That's the first topic we want to start with in this one, because I can't start with who can use salicylic acid and then who cannot use, and then whoever I didn't mention here can actually use aspirin. So let me start with who cannot use aspirin. So those that are allergic to aspirin or other non-steroidal anti-inflammatories. There are a lot of people like that are allergic to non-steroidal anti-inflammatories, and some that are specifically allergic to aspirin. And actually, there is quite a huge population of those people. Yeah, there is a huge population of those people. Then the other group of people that should not use aspirin is people with ulcers or has a history of ulcers. This is because, like most non-steroidal anti-inflammatory, aspirin can actually eat or degrade your stomach lining, leading to the formation of ulcers. So if you didn't have ulcers and you're using aspirin more often, aspirin may cause ulcers. But if you had ulcers before and you use aspirin more often, then the aspirin can reopen they can reopen ulcers. So those people should not use aspirin unless prescribed by a doctor for specific conditions. The other group of people that should not use aspirin is people with kidney problem or reduced kidney function. This is because, like any other non-steroidal anti-inflammatories, aspirin can reduce the kidney function. If you've had that with most anti-inflammatories, that's what usually happens. So aspirin is the same. The other group of people that should not use aspirin is people that are on blood thinners, especially blood thinners like warfarin. Warfarin is a problem, guys. So those people that are on warfarin, I would advise not to use aspirin or anything that contains aspirin. So I'll tell you all the things that contain aspirin, or all the aspirin product. I'll tell you what are those products that are available on the market. So just in case you didn't know. So the other group of people that should not use aspirin is people that have high blood pressure or that already have heart conditions. So those people should not use aspirin, especially high dose aspirin. The low dose aspirin is not really a problem. I've seen a lot of people using it with their high blood pressure, but with the low dose, with the high dose aspirin, you should not use it you should not use it if you have heart condition or you have high blood pressure or hypertension. One more important group of people that should not use aspirin is children under the age of 16 years old. This is because if you use aspirin in children under the age of 16 and you find out they had viral infection, it is possible that they can develop Reye syndrome, and that is quite a very dangerous condition, guys. Don't test that one. I won't talk much about Reye syndrome, but it's a very dangerous condition. It can be very lethal as well. So children under the age of 16 must stay away from aspirin. The other group of people that should not use aspirin is pregnant women. Unless prescribed by your specialist or your doctor, you should not use aspirin, especially in high doses. That is doses indicated for pain, fever, inflammation. Should not use aspirin in those days in those doses. Pregnant ladies should not use aspirin because aspirin can delay labor. The other group of people that we usually forget about that should not use aspirin is asthmatic people, especially the high dose aspirin should not be used in asthmatic people. That is because aspirin has this effect of making the condition worse. I don't want to get into pharmacology when it comes to that, but aspirin, just know that if you're asthmatic, you should avoid aspirin because it can make your condition worse as well. So you can get more attacks when you're using aspirin than when you're not using aspirin. So definitely people with asthma should stay away from aspirin. So we can use aspirin. Adults with any of the conditions that are not mentioned above can use aspirin, but in high doses, not more than 10 consecutive days. Also, individuals that are over 30 years of age that are obviously more prone to developing stroke or blood clots, then they can use aspirin in low dose for prevention of clots. but it's best that you get this prescribed by the doctor before you initiate your treatment. When it comes to use of aspirin in children and babies, as I said above, aspirin is contraindicated on children and babies. So if you are younger than 16, then you should not be using aspirin. That's why most of the time you don't see any pediatric preparations with aspirin. That's because aspirin is totally contraindicated in children under the age of 16. You can tell me one product that has aspirin for children outweighed. As I said, this is because of the fear of Reye syndrome that develops in kids under the age of 16 if they use aspirin while they have or showing symptoms of viral infection. So to avoid such thing, they decided not to use aspirin at all in children. So it's totally contraindicated. When it comes to pregnancy and breastfeeding, aspirin is also contraindicated in pregnancy or when you breastfeeding, especially in high doses that are used for pain, inflammation, and fever. They are contraindicated. Low doses can be used for prevention of clots during pregnancy. I've seen a lot of scripts that have aspirin or just in low doses for indication of blood thinning. Blood thinning. So high doses contraindicated. But even low doses, although the low dose aspirin is available over the counter, but you cannot get it without a prescription if you are pregnant. You are not allowed to get it if you are pregnant. You can only get it if it is prescribed by your gynecologist or your doctor. We prefer to actually be a gynecologist or specialist that initiate aspirin on a pregnant lady. Let's get into aspirin dosing. When it comes to aspirin, there are a lot of strengths in the market, so it can be confusing as to which strength must I use, when should I use it. So I just want to break that down for you. When it comes to aspirin dosing, you usually get about 2 strengths that you can buy without a prescription in the front shop. That is, you can buy it in a retail shop or at the pharmacy in the front shop without going to the dispensary. So those strengths, you usually get about 2 strengths. You get the 500 milligrams and the 300 milligrams tablet. So the 500 milligrams tablet, how you use it. So the 500 milligrams tablet is indicated for pain, fever, and inflammation. So if you're using that tablet, you can take 1 or 2 tablets. That's an adult dose. So you can take 1 or 2 tablets 4 to 6 hourly after meals for not more than 10 consecutive days. And then when it comes to 300 milligrams is also indicated for pain, inflammation, and fever. So on 300 milligrams, then you can take 1 to 3 tablets 4 to 6 hourly, not more than 4 doses a day after meals as well. So also not more than 10 consecutive days without consulting a doctor. So that means the maximum dosage you can take for the 300 is 3,600 milligrams a day. As I said, aspirin can also be used as a blood thinner. So when it comes to the blood thinning effect, it's usually a dose of 300 milligrams or less that is recommended for blood thinning effect. So when it comes to that, then the 300 milligrams that you find in the front shop can also be used as a blood thinner, but that is not the indication of those formulations. But it can also be used as a blood thinner because they are more cost effective. So the 300 milligrams can be taken as a whole tablet, which is 300 milligrams, or sometimes the doctor can prescribe half. So you can take half of that tablet once a day, not more than once a day. If you take it more than once a day, then you don't have the blood thinning effect. So according to research, there is no evidence that shows that higher doses are superior to the lower dose. So the higher the dose of aspirin you're using, you are increasing the risk of getting more side effects. So If you have an opportunity to use 300 one full tablets or half a tablet, I would suggest that you go for half a tablet, the lower dosaging. There is no valid evidence that shows that 300 milligrams is superior than 150 or 100 milligrams or 81 milligrams for that matter. As I said, anything that is less than or equal to 300 milligrams once a day has a blood thinning effect. There are special formulations in the market that are made for that purpose. So most of the time, I know in public hospital you get like 150 milligrams tablet. You barely get that in a retail pharmacy where we sell 150 milligrams of aspirin. So if the doctor happens to prescribe 150 milligrams of aspirin, we usually give the 300 milligrams that you get in the front shop, and the customer can break it, but you barely get a full tablet. I think I've seen a full tablet in a public setting. I think there are 150 milligrams tablets that are used as blood thinners. The most common formulations that you will find in a private sector that are prescribed as a blood thinner or an aspirin are doses between 100 milligrams to 80 milligrams. Things that range between 80 and 100 milligrams. In the past, I've seen 75 or 70 milligrams of aspirin formulations, but I don't see them anymore. The lowest dose I've seen is 80 milligrams. There's also 81 and it goes up to 100, but basically I've seen a formulation of 80, 81 and 100 milligrams. I haven't seen anything else, but any company can produce anything in between those two doses. There's no regulations on that, but I've seen only those three dosages for blood thinning. So those ones, there's the one that you will usually get over the counter. So anything that is less than 300 milligrams, you will probably get it over the pharmacy over the counter in the dispensary. But if it's more than 300 or equal to 300, then it's gonna be in the front shop. You get some special formulations that are meant for blood thinner, but those are only available over the counter. So you get blood thinners formulation that start from 80 milligrams. You get 80 milligrams, sometimes 81, and then you can also get 100 milligrams special formulations. And then on those formulations, you get like sublingual tablets or tablet that you put in water that you can drink. And then you get a normal tablet that you can drink, and then there's enteric-coated tablets. Those tablets must be taken differently. So when it comes to normal tablet, not the enteric-coated tablet, the normal tablet, the one you can dissolve in water or take as a whole, those tablets should be taken after meals or with meals, just to prevent gastric degradation. Because if you take it on an empty stomach, then you have more chances of getting ulcers than when you're taking it after meals. Although food usually limit the absorption of aspirin, but that's better than taking it on an empty stomach, because you still, if you take it on an empty stomach, as I said, you're gonna get ulcers. But if you take it with food, there will be something that is absorbable, although the absorption will also be disturbed, or the absorption will be delayed, or yeah. So take it after meals with food, if it's not if it's a normal tablet or a dispensable tablet, the one you put under the tongue or dissolve in water. Then the enteric-coated formulations, there are a lot of enteric-coated formulation, especially with the over-the-counter blood thinners, blood thinning aspirin, the over-the-counter one. There are a lot of enteric-coated tablets. I will tell you those tablets. Those ones should be taken 30 minutes before meals on an empty stomach. So as I said, normal tablets after meals, enteric-coated tablets must be taken 30 minutes before meal. They must basically be taken on an empty stomach. How would you know that a tablet is enteric-coated? It will be written on the box. If you're getting you're most likely to get the original box. So on the original box, it will be written enteric coated tablet. So if on the box says enteric coated tablet, take it 30 minutes before meals. If it doesn't say, you take it with or after meals. The reason why enteric coated tablet must be taken on an empty stomach is because that coating stops the tablet from being released into the stomach, then it bypasses the stomach, then it gets released into the intestines where it is best absorbed. And then if you now take that tablet with food, as I said, food interferes with the absorption of aspirin. So if you take an enteric coated aspirin, which is enteric coating, also does interfere with absorption. It slows down the absorption or reduce the absorption of aspirin. So if you take an enteric coated tablet with food, that means you're further reducing the absorption of aspirin, and then you can underdose yourself. So that's why you can't take an enteric coated tablets with food, but you can take a normal tablet with food. You must take it with food to reduce gastric irritation or stomach irritation. Now let's discuss the available products in the market. The most famous one, the most aspirin or acetylsalicylic acid product is Aspirin. Aspirin is basically aspirin. And then with Aspirin, you get two Aspirins. You get the 500 milligrams, which is the red one, extra strength, I think. So the 500 milligrams is the one that is only indicated for fever, pain, and inflammation. It's the one that I said you can take 1 or 2 tablets 4 hourly, not more than 4 doses a day after meals. So that one, you cannot use it as a blood thinner. But there's also like the blue one, the normal blue one, 300 milligrams. There's a lot of 300 milligrams in the market. So there's Aspirin, the regular strength. You get Bayer aspirin. There are a lot of brands that are available in 300 milligrams of aspirin. But the most common one, as I said, it's the Aspirin regular strength. So regular strength, as I said, if you're using it for pain, inflammation, and fever, you can take 300 milligrams or 300 to 900 milligrams 4 hourly after meals for not more than 10 consecutive days. So that means 1 or 2 tablets 4 hourly after meals, not more than 12 tablets a day. So that is if you're using it for pain, inflammation, and fever. But it can also be used as a blood thinner. So because it's quite cheap to compare to other products that you get at the dispensary or over the counter, then most doctors usually put you on this aspirin if they are looking for a cheaper alternative. So they will say maybe take 1 tablet once a day. That can also achieve the blood thinning effect. Or sometimes they will say break the tablet in half and take 1/2 once a day. So in that case, you are dissolving that half in water or you're putting it under your tongue, but you must take it after meals to prevent the gastric degradation. Then we get to over-the-counter formulation that are used as blood thinner. You get two common formulation, the normal tablet or the sublingual. I'll just put them in the same category, the normal tablet or the sublingual tablet. So let's start with the normal tablets. Your normal tablets, you get like your Tiva aspirin, which you only get a click spot, the whole thing. You get the Tiva aspirin, you get Aspirin, Aspirin cardio, the one that goes under your tongue, or you can dissolve in water. Those are the normal tablet, and the myoprin. Those ones should be taken with meals. So take it with meals or after meals, but not on an empty stomach. Very important. Must be taken after meals, not on an empty stomach. And then you also get on the enteric coated tab formulations. Most of the other aspirin, low dose aspirin that I didn't mention, most of them are enteric coated tablets. The benefits of the enteric coated tablet is that it doesn't irritate your stomach. Or it has low irritation on your stomach. So one of the formulations that you get on the enteric coated tablets, you get Equotrin, Concord, Aspamine, then the Bayer aspirin cardio, Coprin, Triprin, and other formulation. Those formulations that will, as I said, that are indicated enteric coated tablets outside the box, those formulation you take them 30 minutes before meals. So you take them basically on an empty stomach. When it comes to pricing, one thing I won't be telling you is the cost of Disprin, the front shop Disprin, the red and the blue one. I won't be telling you that, guys. I'm sure you're familiar with that. You can just go to the shop and check how much it costs. Obviously, the prices would vary per shop, so I won't be discussing how much that costs. But when it comes to the over-the-counter ones, it will depend which formulation you're on. So if you go into the Tiva aspirin, so remember I'm discussing the single exit prices here, the price before VAT and dispensing fee. So the 30 packet of the Tiva one, it cost about 33 rands 52 cent, and then the Disprin Cardio Care, it cost about 53 rands 15 cent. So as you can see, the aspirin is quite cheap as well. And then when you go to the 81 milligrams, which is Equatrin costs 50 rands 84 cent, and Cancat, the generic, 40 rands 69 cent. Aspirin Trinity, that cost 38 rands. And then if you go to the 100 milligrams, the Bayer aspirin 100 milligrams, the Bayer aspirin costs 51 rands 12 cent, Myoprin 36 rands 67 cent, and then you get Disprin Cardio Care. Disprin Cardio Care costs about 53 rands 15 cent. So those are 100 milligrams for you. And then, yeah, as I said, 300 and 500 milligrams, you can check it yourself. I won't be discussing the price of that because the price is not really hidden. You can just go to any shop and check how much they cost. That's not really something I want to discuss now. It's the same as paracetamol that I didn't want to discuss. This is the same situation. I'll only discuss prices of items that are only found in the pharmacy. If you can find it without a prescription in the front shop or in any retail shop, and for that matter, I will not be discussing that. When it comes to scheduling, you must remember when I did my scheduling video, I said scheduling depends on various factors. One of the factors is the indication. One molecule can have different schedule because of different indication. Aspirin is one of them. So if the tablet or the dosage is indicated for pain, fever, and inflammation, then it's scheduled 0. So you can get it in the front shop. So for example, 500 milligrams of Disprin and the 300 milligrams of Disprin and other related product like your Bayer aspirin, you can get them in the front shop without a prescription. In matter of fact, you can get it in any retail shop or a garage, petrol station, kiosk. You can get Disprin without any prescription or without going to the pharmacy. But when it comes to products that are indicated as blood thinner, they are scheduled 2, then you get it over the counter. Although you don't need a prescription, but you still need to buy it at the pharmacy. So those products include your Bayer aspirin, your Disprin Cardio Care, Myoprin, and all that. So those you don't need a prescription for, but you have to buy them over the counter. As you can see now, the dosage in this case is reversed. So the one with the lower dose is only available over the counter, and the one with higher dose is available on the floor. It's just the indication, what is it used for, that makes the scheduling different. Yeah, so that's how the scheduling goes. Yeah. So that's it from me today. I hope you learned a lot about aspirin. I hope those mistakes you were doing when you're taking aspirin, you're gonna correct them now to prevent those side effects. On my next video, I will talk about topical formulations of not really aspirin but salicylic acid, or because aspirin is also like a salicylic acid. I will talk about topical formulations of salicylic acids, and then tell you which product are salicylic acids and how to use it. Other than that, stay on meds for more clarity, not confusion, 1 minute at a time. If you have any comment, question or query, then just put your comment on the comment section below. See you on the next one.